and good evening. Thanks for joining us tonight. This is another edition of The Doctor is In with Dr. Randy Smart, and he's going to hopefully bring some topics to you that are useful in your life, useful every day, or useful to your family members. And tonight's topic is a little bit, I guess we're supposed to do the disclaimer and the fact that it may have some graphic biology stuff here, maybe down in the nether regions a little bit. So
Exactly.
if that is a touchy subjects for you, then the warning's been given, right?
Right, if you're under 12, you probably ought to discuss it with your parents.
Understood. So it's, what are we talking, bladder infections?
Right, John.
Okay.
I wanted to talk about bladder infections. And so bladder infections are very common. They are very disruptive. And we actually don't talk about them a lot because they're, your privates.
Yes.
But we know quite a bit about them, and I thought it would just be useful to our
Yes.
audience tonight to talk about that. And maybe the place to start is with sort of where the bladder is and what it does. So the way that system works is most of us have two kidneys, one or two, usually two. And then there's little tubes that connect those kidneys to the bladder. That's what we're going to talk about tonight. And the bladder is about the size of a large orange.
Got it.
And then there's a little tube coming out the bladder, and that is daylighted. I think that's how it's
Got it.
referred to, daylighted. So that's the system. And any part of that system can become infected. And that has different implications and different risks. But the bladder is really very common. In fact, it's so common that, if I remember this right, by the time you're 32 years old, if you're a woman,
Right.
by the time you're 32 years old, 50% of those will have had a bladder infection.
Wow.
That's a big number, right?
Wow.
Yeah,
Yeah.
yeah.
Now, is it almost entirely women? Do men, what percentage of men will ever get a bladder infection? Is it
It's
a
like
rounding error?
It's like 90-10.
Okay. Yes. Right.
So this is men do get infections. They tend to get prostate infections, but it just doesn't compare to women.
Got it.
And so one of your questions might be, well, why is that? Well, the tube that goes from the bladder to daylight in a woman is only about that long. Right.
So the distance that it has to travel is its proximity to anything.
Exactly.
Got it. Okay.
Exactly. So it's a very short tube. It gets exposed to lots of potential infectious stuff.
Right.
And that kind of is the problem. That's the issue.
Right. So there's reasons that, so they get exposed to, so most infections and stuff are the men's fault anyway, right? I'm just kidding.
They actually are. He's right. They actually are. Right. We could talk
It's
about
all
that.
our fault, but
Right. So one of the biggest risks for bladder infections is sexual
Right.
intercourse.
Right.
To your point.
Yeah.
And so a very common scenario is every time I have intercourse, the next day or the day after, I get these stupid bladder infections. I'm supposed to be working all day. This is driving me crazy.
Right.
What do
Right.
I do?
Right.
Absolutely.
So
I mean, there are other triggers.
So if you see a woman with an IV bag of cranberry juice, is that a giveaway, or is that? I'm just kidding.
Do I have to answer that?
I'm just saying, what are some of the things that I guess we jumped? I was trying to be funny, but I know that's one of the old.
I thought it was fun.
Yeah, that's one of the old things where
Right.
people always say, drink cranberry juice, but.
The whether cranberry juice works or not is in doubt.
Got it.
But personal experience, well, not so personal, but when a patient is really locked into their cranberry juice, you should let them have it. It is okay. Because do not separate somebody from the cranberry juice
Got
that
it.
believes in it. Doesn't
Got
do
it.
any harm.
Right.
Doesn't hurt anybody.
Right. Right.
It's okay. But
It may or may not have an impact.
if you're a non-cranberry juicer, it's probably not going to help.
Got it. What are the standard treatment regimens now then?
Well, let's good question, but let's take a
Sure,
step
sorry.
back. So almost all these infections are bacterial infections. They're not viruses. They're not
Right.
COVID. They're bacterial infections, and the way they present is very predictable. So what we want to make sure is that the infection is in the bladder and not somewhere else. And somewhere else could be the kidneys, and that's a different animal.
Right.
But if it is in the bladder, what these patients usually have is urinary frequency. They have to go a lot. They have urgency.
Sure.
Have to go. 10 minutes later, they have to go. An hour later, they have to go. They're not going a lot.
So they're like an older man.
Perhaps. And then the other symptom that is pretty reliable is what we call dysuria. And dysuria is burning. So the classic presentation is, I seem to be going like every hour and it burns. I mean, that is probably as diagnostic as you could ever get.
Right.
And what is also interesting is once you've had that, which 50% of women under 30 have had, over 30, once you've had that, it's very recognizable. They go, I've got it again. I mean, once you have it, there's no confusion going
Right.
forward.
Right.
And recurrence is pretty common. I mean, a recurrence probably on the order of 30%. Yeah, so what, 1 in 3 of those women will get it again and again and again.
Right.
And so there are very good treatments for that. And the medical community is a little bit divided about how to manage this. I can tell you what the standard management is, and then I can tell you what my spin on
Sure.
this is.
Yeah.
So we treat it with antibiotics. Now you don't have to treat it with antibiotics. You can treat it with fluids, water. You can drink a couple liters of water. You can give it a day or two. Many of these resolve without doing anything more than that. But if it goes on more than 24, 48 hours, we should probably treat it. And the treatment is antibiotics. Now, it's not these powerful antibiotics, and you don't have to take them for a long period of time. I mean, one of the regimens is one of the regimens is one pill. You take one pill and you're done. The problem is it's kind of an expensive pill. You know how that goes.
Sure.
It's a little pill like this, comes in a box like this, which comes in a bigger box like this, and a bigger box like that, and so you spend $50 on the box, and
Right.
you dig through it, and you get the
You
little
find the
pill.
one little
Right,
pill.
you get a little
Yeah.
pill at the bottom.
Yeah.
Yeah. So one regimen is taking that pill. Another one is only 3 days of pills, and that costs pennies. And then there's one that's 5 days, but it's not like you're on it for weeks.
Right.
And
Right.
and the antibiotics are really well tolerated.
Okay.
Not a lot of side effects.
Sure.
So if you were to have that bladder infection, many practitioners would say, well, you need to come in. We need to do some testing. I need to write a prescription.
Right.
And it becomes not an all-day event, but it becomes definitely disruptive.
Right.
Personally, I think that's unnecessary. I think if she were to call me and say, Doc, I've got burning and frequency, I'd say, what's the closest pharmacy?
Right.
And there's even other things I would potentially do. I might give her, if she's somebody who has recurrence, I might give her a bottle of antibiotics and say, here's your antibiotics, here are the guidelines. Don't, give it to other people, don't sell it. But when you get these infections, you can take these pills this way, and if you need help, let me know.
Right.
Give them the tools to help themselves.
Right. I guess you talked about flushing and fluids. So maybe one of the benefits of the old cranberry thing was just a dramatic increase in fluid intake, so that way it helps some of the flushing stuff. Is that because you
That could be the effect, right?
Okay.
So,
Okay.
so let's say you did an experiment where patient A drank 3 liters of cranberry, patient B drank 3 liters of water. The results would probably be exactly the same.
Got it.
But do not separate people from their cranberry juice. You could get hurt.
And if you were comparing the 3 liters of cranberry to a few cups of water, then obviously the cranberries
Way better.
was going to
Way
win.
better.
Yeah.
Maybe it's more palatable. I don't know.
Okay.
I like water.
Yeah.
But not everybody does. And, some people are on well water or rusty water
Yeah.
or whatever. And, man, if the cranberry tastes better, I don't have any problem with
Yeah.
that.
Preventative measures. What are things that can be done to lessen the frequency or lessen the incidence?
Yeah, so prevention, there are things that prevent it, and the water is one.
Sure.
So you can drink a little more water. 2,
So that helps to keep the
kind
possibility
of
of an
flush
onset
in a little
keeps it-
bit.
Okay.
Yeah. If you're one of those who it seems to be related to intercourse, you can empty your bladder afterwards, and that has been proven to be helpful. There are certain spermicides and gels that make these more common, and you could talk to your doctor about which ones do that.
Got it.
But those things are preventative. Those are drinking fluids, emptying your bladder, recognizing that it may be related to a certain event or not. But having said that, let me just digress
Yeah.
a little bit. So none of those issues may be in play, and you can still get a bladder infection.
Right.
You can be just somebody who is not married, not sexually active. You don't have diabetes. You're healthy, and suddenly you've got burning and frequency. That's not rare. I mean,
Right.
you can just
Right.
kind of get it.
Right.
Yeah, and that doesn't mean you've done anything wrong.
Right.
It doesn't mean you're dirty.
Right.
It just kind of happens.
Do you think some of that's more of our sedentary lifestyles that we have now, or not really? Just random.
No, I don't.
Just-
What I think is most telling is we're learning more and more that genetics plays a role in this.
It's the parents' fault.
It is. It's the parents' fault. It's your mother's fault. So honestly,
So it's either the parents or the boyfriend or husband's fault, and that pretty much
the government. You forgot
the government. Yes. Okay. All right.
So we didn't used to know this when I was in training, but if your mother has had these urinary tract infections, these bladder infections, you're more likely to get them.
Right.
And there are now studies that look at the pH of the vaginal mucosa, studies that look at what we call colonization, which bacteria normally inhabit
Right.
those areas.
Right.
And there seems to be a genetic predisposition to this.
Is it seasonal as well? Is it seasonal at all?
I don't think so.
Not really?
Not that I
Okay.
know of.
All right.
No.
Yeah.
Not that I know of.
So a woman should be not feel. I mean, if it happens to, you said almost 50%, 50% of the population. So
It happens to a lot of them, and they get so frustrated. They call and they say, I've got another one of these. Do I really have to come in? And isn't there anything you can do? And,
right.
And again, there's different styles. I mean, my style is pretty much a phone style, but a by-the-book style is when they come in, you can actually test their urine, and you look for the infamous white cells
Sure.
in the urine,
Yeah.
and that's pretty telling. And you can actually culture their urine for bacteria. In an uncomplicated case, I don't think you really need to do that.
Yeah.
I mean, there has to be a trusting relationship, and and you need to know the patient, and
Right.
and but I mean, if you think about it, John, every cow in this country gets barrels of antibiotics, but we're like really, nobody can get them, and these women have jobs, they travel, they're I think they're entitled to a little bit of latitude, a little bit of support.
Yep.
I mean,
Yep.
I just don't think they have to come into the office every time.
Right.
And I've worked with doctors that say, you don't come in, you're not getting the antibiotics.
Do you think, not to digress into the COVID stuff, do you think the COVID stuff has helped people be more comfortable with, even on on the provider's side, from treating remotely? A lot of the there's been a lot of more of the remote visits and that type. You think that in some ways there'll be some halo effect for medicine ongoing?
I think so. Yeah.
Okay.
Yeah, absolutely. We're seeing it already. People are becoming more and more comfortable with technology.
Right. Right.
And frankly, there is a business aspect to it that works finally.
Sure.
Because
before, until this, there was no real way for you to run it into your billing as
Not
a
allowed.
revenue model, right?
Not allowed.
Okay.
Right. You can make all the phone calls in the world, but we're not paying for them. Well, suddenly there's a pandemic, and they say, well, maybe we ought to pay for them, And so we do. I mean, right now, probably 20-30% of our appointments in the clinic I work in are phone appointments.
Which means coming out of this, your operations may actually be more efficient, right? I mean, as far as you'll be able to, in some ways, you may be able to, as far as utilization of resources and stuff like that, you may be able to be more efficient, or?
Yeah, it'll be more customer friendly.
Got it.
A lot of people have transportation issues.
Mm-hmm.
I mean, if you have Parkinson's disease, try driving.
Right.
They have transportation issues.
Right.
And then some people have anxiety. Every time I get in the car, I start shaking, and you got to come in, and so it's much more customer friendly. And what we found out during the pandemic is we can do a whole lot over the phone. It's not perfect.
Right.
And there's things you can't do over the phone.
Right.
But if you had a phone with a camera on it, man, you can do all kinds of stuff professionally.
Sure.
And competently. So yeah, I think there is a halo effect, and I don't think the government or the insurance companies are going to be able to back out of this.
Right.
I think they're in,
Right.
and I think they're going to have to stay in. I don't think the industry will allow them to back out of it.
Yeah, because it seems like now it's just because yes, if the government gets in the way of customer service, right? Because the patients are going to demand it almost.
There'll be a rebellion.
Yeah.
Right.
Yeah.
Right.
Yeah. All right. What else do we need to know about bladder infections?
Well, let's talk about the difference between simple bladder infection
And warning signs?
and a complicated
Yeah.
bladder infection, because I think that's really important. So if you have these bacteria in your bladder, you can wash them out and you can recover. On the other hand, they can kind of sneak up those other two tubes. Those are called the ureters. And those tubes go to the kidneys.
Right.
And so one of the complications of a bladder infection is kidney infection. And kidney infection is a different animal. It's serious.
Right.
It can be life-threatening. And so we really want to make sure it's not one of those complicated infections. Kidney infections have some telltale signs. One is there's often fever, whereas the bladder infection will have no fever. So they commonly have a fever, 101, 102, 105. They commonly have flank pain. That's a real hallmark of it.
Right.
They say, Doc,
Right.
right here.
Right.
Right here. They have flank pain.
And then you need to see them, right? That's no longer a phone visit. That's
And maybe hospitalized.
yeah, that's
Right.
yeah.
And then they have something called tenderness. So if you take that flank area and you just tap on it, they go, that hurts.
Right.
Knock it off.
Right.
So if you have any systemic symptoms, chills, fever, flank pain, tenderness, if you have any of those symptoms, it's more than a bladder infection, and it really needs to be taken seriously. Should be treated on the same day with good antibiotics and sometimes hospitalization.
Okay.
I think that's really important.
Yeah.
And those aren't rare.
Right.
I mean,
Right.
it's got a big $20 name. It's called pyelonephritis, and we see pyelonephritis frequently.
Though I guess the question is, what percentage would you say of a common, person who has a common bladder infection? I mean, what percentage end up with a kidney infection?
It's not. I mean, there are so many bladder infections that percentage could be misleading.
Okay.
I mean, there are just so many. We probably saw 2 or 3 in the clinic today,
Okay.
and that's not an unusual day. But let's say it's, 1 in 30, 1 in 40.
That's still a pretty significant number.
Every month, you're going to see
Okay.
somebody with a kidney infection.
Got it.
So it's kind of a small percentage. And if a patient were to say to me, well, you're saying I can get by 24, 48 hours with just fluids and no antibiotics, and it's Saturday and there's no drugstore, what are the chances I'll get a kidney infection? I'll say they're not very high. They're just not. And you could be reassured. However, if you're one of the unlucky ones and you get the symptoms, then you really need to find somebody. I don't care if it's Saturday, Sunday, Easter, it doesn't matter. You need to find somebody
Right.
and get it taken care of.
Right. Yeah. You were saying on, prolonged issues. I mean, so you have recurrence. Well, I mean, what are treatment plans? What would you recommend for women? Is there anything prophylactically? I mean, just increased water. I mean, what do you counsel?
We sometimes will put women on prophylactic antibiotics.
Oh, really? Okay.
So there are cases where we have said we want you to take one of these antibiotics every day because you're getting so many of these, and so we don't like doing that because you develop
Right.
resistance, and
Right.
but we definitely do it. Now that becomes more common if somebody has a catheter in their bladder, or
Right.
they have instrumentation, or
Right.
sometimes they have bladder stones or kidney stones that cause this recurrence. So sometimes we'll just put them on prophylactic antibiotics. Sometimes we'll do the deal I talked about where you give them a jar of them.
Right. Right.
And say, okay, I want you to call me, but you've got the jar, and then I'll tell you what to do with it. And sometimes they're able to just do the whole thing by themselves. It's interesting that the diet for an average woman who has had one of these before, the diagnostic accuracy is about 90%. So if she calls you and she says, I think I have one of these,
Yeah.
she probably does.
Right.
Right.
Yeah. Is some we're talking about that area? What are some? I think we have a few minutes left. It's kind of what are some of other urinary tract? I mean, what are things for general population to minimize, to keep healthy bladder, healthy kidneys? What type of things should they do?
Well, I think a reasonable amount of water.
Okay, just fluids. Just keep them going.
Yeah, I think that's a really good idea. There are things kidneys don't like a lot. Protein is one. So remember back the Atkins diet?
Right, right.
The Atkins diet was a high protein diet, or a protein over carbs diet.
Okay.
And in certain populations, particularly diabetics, the kidneys just do not like that.
I mean, some things like some of those keto diets are all the rage and stuff now. Is that similar type of?
I don't know.
Okay.
I really don't know. It's a good question,
Well, I mean,
and I don't know.
like in some of the fitness areas now, they always talk about the gallon of water a day type of thing. Is that too much?
No, that's not
probably
too much.
okay.
No,
Yeah.
that's not. But if the question is, can you drink too much water? The answer is yes.
The answer is yes.
Yeah, you can actually drink so much water, you dilute down the sodium in your system. And if you do, and this isn't all that uncommon, you can get pretty sick.
Okay.
Yeah, so your sodium normally runs a number about 140. You can really pound down the water and get that thing down to about 120. And at 120, you start not mentating clearly, and you start, you have abnormal behavior, you have headaches, you throw up.
Really?
Yeah. So you can drink enough water to get into trouble.
Got it.
Absolutely.
So the old eight glasses a day is still a pretty...
It's not a bad idea.
Yeah.
The other thing I see with kidney disease is pain pills. And I'm not talking about the Oxycontin or
Right.
the hydrocodone. I'm talking about the Advil or the Aleve. And Advil and Aleve, we've talked about this in previous shows, are good medicines that could be used in moderation. But if you're using Advil and Aleve every single day, and some people do that, somebody should make sure your kidneys are okay, because you can damage them doing that.
I've had family members that's just part of what they took every morning. It was like their vitamin and their
Advil.
That's what they did.
Not a great idea. Right. Tylenol is relatively safe,
Okay.
as long as you follow the label.
Even aspirin would be better than, because I mean for a while there they were recommending aspirin for all kinds of stuff.
Oh, everything,
yeah,
right?
Everything.
That's sort of changed.
Okay.
Aspirin, probably when it's recommended by the doctor.
Got it.
And we don't recommend aspirin a lot unless somebody's already had cardiovascular problems,
Got it.
and then it's a good idea.
Yeah.
Particularly strokes. It's a
Yeah.
good idea.
Yeah. So it does even for stroke for people who've had a stroke and stuff. It's still
Preventing
part of that.
another one.
That
exactly.
regimen. Yeah.
Yeah.
Does exercise help? Walking. I mean, does walking?
Kidneys?
Yeah.
What doesn't help is the thing where you make the New Year's resolution, and if you want to see this, go to some recreational field on January 1st or 2nd, usually about the 3rd or 4th. But what you'll see is a bunch of people out there with brand new exercise clothes.
Right.
And, they're great people, but it's just too much too quick. And so they actually break down muscle.
Got it.
And that muscle breakdown product is really toxic to your kidneys.
Oh, so interesting. So the
Yeah.
So if you're breaking down tissue, it's hard because that's your body's got to process it, right?
You can trash your kidneys. Yeah, big time. I mean, like we're talking like dialysis. I mean, you can destroy your kidneys doing that.
Wow.
So on January 3rd, don't go out and run 5 miles for the first time and take a bunch of Advil.
Got it.
That would be a really bad idea.
Thank you for joining us, and thank you for what you do. Appreciate it.
You're welcome.
And thank you for the information, and it's valuable stuff. Thank you very much.